right. Dr. McKinney, welcome to Treaty 10 News.
Well, thanks for having me again.
Well, COVID has really been hit hard worldwide. We're watching the World Cup right now, and we see uh, Canada is part of an international community, and that's how this COVID came around. Was all that international travel, and it hit our communities. I think it was South End here in northern Saskatchewan that we first
Yes.
had the first cases, and then we learned about isolation and all that. So let's recap on just now. What is the message you would give our families as we face the winter coming up and the latest statistics you're aware of? So just
Yeah.
talk to our families and let's see what you have to say for our protection.
Sure. Well, I guess the big message I would say is COVID is not over. In fact, it's alive and well. But the good news is I think we've learned how to be able to manage with these with COVID and with the other viruses that we're seeing too. And I think that's the other messaging is that there's lots of other viruses out there. And when we were first talking about COVID and we were looking where everybody was kind of holding tight, trying to make sure that we were doing all the right things. We actually never saw the flu or this RSV, the respiratory syncytial virus that the little kids are struggling with right now. But so it tells us that what we know about how to protect ourselves from viruses works. And so what we're also seeing is as we were worried about all these mutations, when we kind of relaxed and stopped, doing what we know to be right. I think it really meant that there was a lot more travel. I mean, people are traveling on planes now without masks. There is a lot of travel going on. And unfortunately, what that means is that not only with travel, but being exposed, I think the other thing is a lot of people, they can't afford to take time off work. So even if they're not feeling great, normally before COVID, you would probably go to work, even if you had a little bit of a sniffle. And we kind of made fun of people. It's just a cold.
Right.
But now we have to be more careful. And so, but what we're seeing is there's more of this virus out and about. And as it has a chance to grow, it's been mutating. And so it's an interesting time right now because it used to be that we'd see these waves, they said the BA1 and then the BA5 or the Omicron, all the different types that we've had. But now what they're saying is that this virus is mutating so much that there's multiple different mutations that are out there at any one time. And we even see that when they do those studies of the wastewater where they check, to see what kind of viruses are there. It's a real mix of different types of this virus. So I think it's concerning because we don't really know what's coming our way. What is also concerning, you were talking about the world and the travel. Right now in China has been very diligent about keeping people isolated and all of these different things. And there has been some rebellion now, particularly in some of the factories, because it's not the same kind of precautions we took here. It's that they were making them stay in factories and working, not going home, not giving them food and all kinds of stuff. So now they've been rebelling because they said, enough, we're not doing this anymore. But
Oh,
when that's happened, all of a sudden they're starting to see more and more outbreaks in China. And so because we know it's a big amount of people, that the chances of those mutations are probably going to be very high. And so again, is that going to travel around the world? Are these things that we're going to see? They've been pretty. You started off talking about the FIFA, the World Cup, but I think they have been fairly careful there. Like most of the countries test their athletes. They do try to keep them a little bit isolated. They have a bubble, and so as long as people stay in the bubble, that usually is very helpful for sure. What we've seen before, even with the hockey, when things they tried a bubble with some of the hockey, and some of the hockey players came out as well as being positive. I think there's still one from the Vancouver Canucks I was just reading about that still hasn't come back. So we know a lot more about what we need to do to protect ourselves. Things like getting vaccinated if you can. Not only for COVID now we need to get our flu shots as well, and just all the general things we can get vaccinated against. And there's lots. Vaccines actually protect us, and we're learning how to use vaccines even to protect us against cancers, because sometimes some viruses lead to cancer. So we want to be able to protect ourselves. Um, we know that washing our hands regularly, especially after we've been touching things or being around others, is really important. We know that masks actually really help a lot, particularly if you can get good quality masks like an N95 or a KN95. And even if you can't get one of those, they call they're medical masks, but they're a level 3 is what they call them. So they're better than nothing. And even if you wear the cloth masks, that's still better than nothing. Meeting people outside, and keeping a little bit of distance if you can. I always say, the nice thing about wearing a mask is I still come in for my hugs. Still get to, we can still be near people, but we have to be careful what we do. Doing the testing now, it seems to have fallen off a little bit
Mm.
because the tests that they developed initially were for the initial forms of COVID. So people don't always test positive for the types of COVID that they're having now. And we do know that COVID also affects our immune systems. So it decreases our immune systems, and we don't know how long it lasts for. For some people, it seems to last longer than for others, but it is several months afterwards that your immune system is down, and it can be for quite a long time. We don't know. But what that probably means is part of what we're seeing for these little ones right now that are getting sick with flu and with RSV is that it's a combination of having a reduced immune system and then not being able to fight off those infections for sure. We do know for moms that have had RS or had COVID when they were pregnant, those babies' lungs aren't working as good as babies that moms didn't have COVID. So we're still learning a lot of things about this virus. It's pretty wily. We know that it can have lingering effects. There are things that it can do, like it seems to cause very small micro blood clots in the brain, in the heart, and those lungs, those types of things. So risk of stroke, risk of heart attack is much higher, even for younger people, and sudden death as a result of that. um, Blood clots in the legs and in the lungs can be another one that people will see. And we know that people who are older, and older being 50, like 40 or 50 even, we're not talking that old. Maybe it's just me, but but they can actually start dementia, and it can come on very, very quick, very rapid dementia. And so, it's interesting, even people who've had more of the long COVID, they talk about this brain fog and how it affects their brains. So I suspect that this brain piece is affected even in young. And in fact, again, when you look at the research, they've done CT scans and stuff on brains, even of kids, and they show changes related to this virus. Again, we don't know, is that permanent? Is it long term? Is it short term? Hard to say for sure. But the other thing we know is the more of those shots you get against the virus, the more likely it is you will not have the long-term effects. And so we see that people that get COVID that have had vaccines often really aren't sick for very long at all. We've seen that before with some of the earlier viruses where people didn't have any shots, but they got over it pretty quick. But the more times you get it, the more likely it is you're going to get some of these effects. So it's kind of a little Russian roulette in a way, for sure. So that's
Just,
kind of where we're at now.
I was just going to ask the vaccine. So people keeping in mind their vaccine schedule, is it still 4 months that you should be looking for a new booster after a 4 month period?
Yes. Well, and they say for younger people, like, say a 20-year-old, you could even wait up to 6 months, to be honest. The studies are showing that the numbers, like if they were to test your blood and see how many of those little antibodies are in your blood, that it starts to drop off after 3 to 6 months, or 3 to 4 months, sorry. But for as people that are over 50, we're more prone to some of these problems. And so we want to make sure that if you're in that age group that you're getting your vaccine every 3 4 months. Probably 4 months is better. It's a more robust reaction. For younger people, particularly for young boys or men, I would say probably from the 12 to 25 or so mark, or even 30. they might want to wait 6 months because it's not a very high risk, but there is a little bit of a risk of this myocarditis. They call it inflammation around the heart. Even for
Okay.
those that do get it, it's usually not long lasting. It doesn't usually have any long term effects, but you are at a little bit more risk if you are male in those age range. Anybody who's got any kind of conditions that lead to decreased immune systems, so people who maybe have like rheumatoid arthritis and are on some medication that lowers their immune system should get it every 3 months, come rain or shine. Even somebody who has diabetes, diabetes itself doesn't make your immune system decrease, but because of you're more prone to infection, you probably should get your shots like every 3 to 4 months for sure as well. So yeah, I laugh. It used to be, the drug addicts would hit their arm and say, "Oh, hit me up. We're all going on up here. Hit me up." Give me the new vaccine. I'll take it. So yeah, I've had 5 shots myself now. So that's good. I've not had any negative effects from it. And I always laugh. There was a guy in Germany, this was probably a year ago now, who was taking shots on behalf of people, and then that way the people could say they got their shots. He had 29 in like a month, I think it was. And he did well. He didn't have any problems. So you can get a lot without any problems. But it seems like we're working to get towards something that would be maybe more longer lasting and would cover all kinds of different mutations. So that's still to come for sure.
Okay. I guess the initial pandemic when it came out, what we were looking for was herd immunity. If everybody got infected, that we'd all have our antibodies and we'd be able to fight it. But they didn't know because it was the novel virus, right? So they didn't know what it was about. So the reality now is it reinfects. Some people have got 3, 4 times now, they've been infected with COVID, and then the
Yeah,
impact of that is also long COVID that you mentioned.
yeah.
But the message is get the booster shots, right? Is that's
Yeah, absolutely. Yeah, there's no such thing, I think, as herd immunity with this virus because it just keeps changing. And I would actually say that for me, myself, I was a bit skeptical to begin with because we know that virus changes. And knowing that the long-term effects are so deadly or, so difficult, it's a bad one to play with in that way to think that. But we know you're right. You can get infected multiple times. There are people that I have patients that have been infected 5 times, and so it can really do some reinfecting, and you can get it even as fast as 2 weeks after you've had it. So
oh,
it's not that you have a whole lot of antibodies against it. And I like some of the analogies people have used now is the idea that, oh, you just need to be infected and you'll be fine. Well, HIV is a virus, human immunodeficiency virus. We definitely don't want to get that one. It doesn't leave our system. Things like chicken pox will lead to shingles later on in life. So that's why we started giving shots for kids not to get chicken pox, and the fact that it can make kids quite sick. So, like it stays in our bodies. Things like cold sores are a virus that stays in our bodies. So it's looking more and more like this is one of those types of viruses that probably stays in our bodies or sticks around for a while longer than what we'd like and causes some really negative, really bad things that are not going to be good for ourselves or for our families for sure.
well, one of the greatest fears we had with this virus was the deaths.
Yes.
And hearing the statistics, I think it's every 2 weeks now that the government comes up with statistics. So maybe just explain where these deaths are taking place or why, and even the numbers. To me, they're startling.
Yeah, they are very startling numbers, and yet I think people have just really gotten used to them. I think I read somewhere that every 48 hours, 2 people are dying. So, I mean, it's crazy when you think about it. There are some that are dying in hospital, some that are dying at home. But I think the other thing to be mindful of with these numbers is these numbers are really deaths that they can directly attribute to COVID. So they do, they test and those types of things. But that is COVID, the acute the immediate sickness with COVID. There are, like I said, how many people are having sudden heart attacks? How many people are, having a blood clot in their lungs all of a sudden? And they don't necessarily attribute that to COVID. They'll try to do the research behind. And this is where, when some of the work that's being done out of Ontario, they're actually trying to do estimates of how much is really extra deaths are happening. And normally we would have a certain amount. There's over a third more that are unaccounted for, that, and they're likely related to COVID, because that's the only thing that's different nowadays is that virus. So there's probably even more deaths that we know of, or that than we know of, than what is being reported. And the other thing about the deaths that are being reported is it takes quite a like it can take a while before you actually see the numbers. And even though now they're reporting every 2 weeks, they went to every month for a while, but it's still quite delayed. I mean, that's probably about a good 6 to 8 weeks behind, because by the time, all of this data gets collected and gets put out there, it's quite a bit behind. So, it's not that all of these deaths are are they're able to get the numbers right away. And I think the other piece of it is there's probably a lot more than what we actually are seeing in terms of the numbers. So it is very concerning for sure.
Well, when we were learning about this novel virus, we in Cree we call it manchus, so it was a living being. It's an
Yeah.
animate virus. And you mentioned RSV. That was it may have been around before, but the term is new to us. Can you explain that virus and how we can defend ourselves to that one?
Sure. That one is called respiratory syncytial virus is the fancy name. It has been around for a long time, and kids can get quite sick with it. I remember I was up in Northern Ontario working at that time, and I had 6 babies that I was shipping out on like bag, using the bag to help them breathe. So it's been around for a while. It's a bad one in that what it does is it kind of helps form these kind of giant cells, and they actually block off the airways, and little kids have smaller airways than we do. So that's what makes it so much more dangerous for young kids. There is a thought that you can get it a few times and then you get immunity to it, but we don't have a vaccine for it. um, Kids would generally get it in the past, but we're seeing numbers now that are way higher than what we had seen, particularly all at once, and that's what's leading to the overcrowding at the hospitals. We have seen some deaths. Some of it is related to the fact that they can have the flu bug along with the RSV.
Uh,
And it's interesting because this COVID virus has some ability to form those giant cells as well. And so for little ones, those they just block off the airways, and it's really hard for them to breathe. And there's been pictures on Twitter and stuff, where people have videotaped their children. So it is very scary because these are young little kids. It's usually 4 and under that are most at risk. And gosh, those are the little ones that we want to protect the most. But we do know, even in way in the distant past, it's always the very young that are and the very old that are more prone to these things. But in this case, it's the very young, and we are seeing like a lot of kids with this RSV, more so than I think what we expected. And that's where this controversy is coming in. Gee, should we be putting in the masks back at schools?
right.
Because it's not the school age kids usually. They will get a cough, cold kind of thing, but they're bringing it back home. And so if we could somehow try to slow it down or make it so that it's not as all at once or hitting everybody all at once, is there a way we could stop some of this for our young kids? Because the other concern is now that our hospitals are so overflowing, if you're sick, will there be services available? We're getting pretty desperate. The worry is around Christmas time coming up. We're running short of nursing staff and lab staff, and that's everywhere, but definitely in the north as well. We have seen some disruption of services throughout our province, but in the north as well, for sure. And my worry is, what do you do if there's nobody there? Like if there's, you can't go to the hospital or you can't get in because the waiting room is so packed. What if you're waiting for an ambulance to take you out and there's only one ambulance available? Those things are real. They're happening right now. And I think they're going to be getting worse, to be honest. So
Yeah.
this is where I also think, I have talked about this before. We do have traditional ways of keeping ourselves healthy and well, being outside, going for walks. There was a study a while ago too about even if you go for 15 to 20 minutes a day, that helps to clean out your lungs and it kills whatever viruses are there because it's so cold out usually. Of course, hopefully we don't have the global warming, but hopefully it's not so cold we can't go outside. But we used to, as traditional people, we would be outside quite a bit. We would drink our teas, to keep us healthy and strong, keep our immune
Right.
system strong. So I think those things are all really still really important. And I think we probably need to think about that and how we approached health as a traditional way as being a strength to keep ourselves healthy as well.
Yeah, it's so, like the RSV, the COVID and its variants, and then you have the flu, then you have the
Yeah.
common cold that's still going around,
Yeah.
and we're acting like it's all free right now, and that's the scary part. Like you said, the debate with, the masks, I think the
Yeah.
government is blaming households, saying the transmissions are happening at the house,
Yeah.
but medical doctors, because nobody's keeping track, the vectors could be in at work, a place of
Yeah.
work, you could be at a place of shopping or the school, and then you bring it home. So
Yeah.
it's the defense is still that masking. I think
Yeah.
are you I know the MHOs, Dr. Ketla and Dr. Sobel here in the north that provide us, they've consistently recommended masking to
Yeah.
continue.
Yeah, I absolutely do, and I do it myself. I wear that N95 all the time, and it's been very good. But I agree with you. I think it's where the areas of people where people gather that that's where the virus is going to be. And I have to admit I've gone to different events now, but I'm wearing my N95. So I've even gone to a concert. I wear my N95, and my kids are wearing their N95s. I will test before, I test after, even though the tests might not be very effective. And we don't go anywhere for a while afterwards either, like for at least a good week to make sure that we're safe, that we're not bringing anything around to others. And if anybody in the household has maybe doesn't feel good, has cough, cold, we try to stay away, not kissing each other, not and making sure washing our hands a little bit more, maybe kind of separating out a little bit more if we can. So, trying to do those things, not going to school if you're feeling sick for sure. So I agree with you. It's not the households. It's coming back from these areas. And for kids, they go to school, and not that school's bad, that's good, but we need to take the right precautions. The other big one is cleaning the air, and the air needs to be exchanged about 4 times an hour, and I really think that's the other part where I feel our governments are not, doing well by us because our schools, those are our kids. We want them to be healthy. They need to have good air where they are. And right now, I don't know that all the schools, I'm pretty sure not all of the schools have those good air exchangers for sure.
No, definitely that's uh what we've learned, we still have to practice.
Yes.
That's the
Yeah.
bottom line. We've learned lots. We knew how to take care of ourselves the first 3 years. It's 3 years coming on,
Yeah.
and but it's not gone. And you look at the World Health Organization. I don't know where the status is. It's still a pandemic, or is it now international as an endemic? What's those words mean to
I
you?
think they're still calling it a pandemic. I think, nationally, like in the States, I think they called it an endemic. But in a way, I think, does it really matter what you label it? We know what it is, and we know it's still out there, and it's really causing a lot of problems. I don't get caught up in words. I want to see the numbers, like how many people are sick, how many people are having long-term effects. The worry, I think, too, is not only the death part, but now what's the disability? And so there is some work happening even here through the university around trying to capture, like figure out what is that disability going to be, and what kind of help are we going to need to get people to be functional?
Yeah.
Because there are people that have been so debilitated, and young people, not only older people, but young people as well, who have many years ahead of them, or who have young kids themselves that can't function at home. So, those are the things we really need to start to worry about. But I come back to our traditional way, and we think of things in the circle, and we stand together and support one another. And part of that means we protect one another, and protecting one another is wearing that mask for sure. And, like I said, I know people they don't like it, they don't, feel comfortable. I think when you start to wear it enough, I have to laugh. I've caught myself a few times to go to drink something, and I'm like, oh, yeah, mask on, you know, stupid, but you can get used to it. And then I think somebody was noticing at one point I've got tan lines where I got the mask or not masked or whatever. But anyways, like I said, I think for medical people, we're used to wearing masks, to be honest. I've gone through helping in an operation where you wear it all day long. You don't think about it. But and there are some people that it really just bothers for a variety of reasons. It could be even something like anxiety, feeling like you're too closed in. But you can get ones now that kind of have a little bit more built out. That's one of the reasons I like the N95s is that they kind of give you a little space around your mouth so you don't feel like you're suffocating or anything like that. But like I said, it's finding what works for you in terms of the masks, what is a good fit, and just making sure you're wearing it. And you don't have to wear it all the time. It's when you're around other people or in an open area where other people might come in, because we know that it's not just the time that somebody's in there, it stays in the air. This darn thing is an
Right,
airborne. It's not
right.
just because initially they talked about droplets, but no, it's airborne.
It's airborne, yes.
And yeah, yeah, that's where again, if you can afford to get one of those air purifiers or something, and they have that online now, how you can make your own with a fan and just some big air filters, pretty cheap to make. And like you just use some duct tape and stuff, but it really does make a difference in cleaning out the air.
Well, the other part, just moving on to the perspective of what you said, that's indigenous ways to collect ourselves as a circle and work together.
Yeah,
And that's what we experienced here with the pandemic response. We had the First Nations, the Métis municipal communities, everybody coming together, interagency, didn't matter what jurisdiction, we were going to face this pandemic together head on.
yeah.
And you see the North now, its development for over the years and what the potential it has and also the vulnerabilities it has. So what would you recommend to the North and our leadership and our communities? What should we be striving for? You have the First Nations, we have the different districts. You know the North very well, and you
Yeah.
what recommendations would you have that we should be striving for?
Well, I would say that do what you know works. The North people have survived there for years because they work together. It doesn't matter. Again, I would wash away these labels because that's really all they are. So I would actually just work together as you have been and always have, and just come together and using your knowledge and decide what's best for your communities and trust yourselves. You don't have to rely on other people to tell you what to do or what the terms are. You know what you want to do. You know that you want to protect your kids. I find that really we have these wonderful meetings, the Northwest Information Command Center meetings that honestly, like people are very knowledgeable and they really have a great way of sharing the information and then taking that back to their own communities. I think the more that you can strengthen that and support that, and then advocate for yourselves as well, or get others to help as well to actually get that funded so that you can carry on, because people do get tired and get burnt out. And the more you can do capacity building with the youth and involving the youth in how to protect ourselves, the better it will be, because then the more people you're going to have to rely on. And we all know, like, we never know when one of us is going to get sick, or, that, something will happen. So we want to make sure that the legacy is there, that this continues on. And like I said, for all of the things that have ever come along, whether it's been TB or smallpox or whatever things have happened, there is resiliency and strength within the community for sure. I mean, I don't know. I think, again, when we had been talking a little earlier about that book, Clearing the Plains, it was a genocide of our people. That was the intent. But we didn't die, and we're here and we're thriving and we're doing well. Yeah, exactly. So, we kind of have done the, in your face kind of thing. I would carry on because it's working. And I don't think what you're doing is bad. I think it's actually, what's right for you. Carry on sharing the information, doing what you know, working together. And it's, you can work with government too. It's not to say you can't. I don't mean to imply that, but trust in yourself. Trust that what you know is the right thing for you, and care and continue to do that. And I think the more you get comfortable with that and continue with that, the stronger the communities will be and the people will be.
And I guess as you mentioned, the youth and the kids. and some of these may have the gift, the same thing as, you
Yeah,
found your gift and your calling for medicine.
yeah,
These young kids are challenging, with the attendance in school right now. There's a lot of pitfalls in the communities themselves. You got the addictions, you got the gang activities, and there's no relief when you go into big cities, when you go for higher education. So,
yeah.
in the modern, what advice would you give our grandchildren, I guess, in searching their gift into, especially the medicine, if they can carry a gift of the healing, and if they can find their way there, what's the proper way? Somebody coming in, how would they fulfill their dreams today?
Well, I think, there's a couple of different things. We need calm, quiet time to be able to kind of let ourselves feel what we're feeling. But I do think knowledge is power. And yes, school is knowledge, so that can be very helpful and powerful. You really kind of need your education nowadays in order to get any kind of job, and you need to be able to earn money in order to be have some control over your own life for sure. But I also think anytime you get that chance to get knowledge, particularly from our kiteyak, from our elders, from our, and we can learn from everybody. I always say I can learn from 2-year-old kids. They have insights into things that sometimes we don't even think of it that way, but it's like, wow, like they really know. And when you think about our traditional teachings that these little ones are here to teach us, we need to be open and to learning too, to role model to our kids what we want them to do and see. But even if you don't know much, if you know how to smudge, maybe do that on a regular basis and show your kids, involve them in that. And for the kids, if they can, anytime they get those opportunities, my kids, if they get an opportunity to go to a sweat, for instance, I really encourage them to go, because the more that they can feel comfortable and knowledgeable and really feel good about who they are. I think of Isla Cross with the music that they have. They've got a music center there. Bring that, the more that you can share that, and if you know somebody who knows how to play guitar, well, go learn. Like, that's okay. Just be open to all kinds of things, and that is one thing I think with my mom and my dad even. They were both really open to things. They would try all kinds of stuff. Even something simple, like if at the grocery store they saw something, they'd say, "Okay, well, we can't we can only afford this little bit. Well, we'll try it and see." But they were always willing to try things. And I think of myself, that was me too. I'd hear of something, I thought, "Oh, okay, let's try that." Got me into some trouble sometimes, but not in a bad way. But I think of all the different things, I just sort of signed up for it. And I think, "Oh my God, what was I thinking?" But you know what? Without having those experiences and without being open to it, you don't know what your limits are, what your borders are. So always be willing to try it and see and expand your life. Like I said, I think now, when I was little, I couldn't have even imagined of all these different things. And I think it's the same with the young people now. What's coming, you can't even begin to imagine. And it's not all bad. The Mother Earth and our the way we are, that there's always balance. So they'll be bad, but they'll be good too. So
No?
always seek out the good, always learn, always try and see what's happening.
Well, I appreciate this dialogue, Dr. McKinney, and we're proud of you representing Northern Medical Health Services. The challenges aren't small, because this pandemic and these illnesses and the statistics are telling us we have to be very careful, especially going into this winter and the Christmas. So thank you for your message, and we'll stay in contact. But in closing, is there anything that you want to share? Whatever you want to say.
Well, I just say what a privilege it is to spend time with you and with all the people in the north. And again, I would say that the knowledge that you have is incredible. That ability to be right there in with the land and see that it's worth protecting. It's absolutely worth protecting. And so, if I can say anything, I would say don't give that up. Don't ever give that up. Don't look on the TV and think, "Oh, that's way back." It's not. What you have is a golden gift right there, and that's from creator. And so creator has given you all those ways of being able to do what you need to do. So you have it in you already, and that's the other part. You need to know that it's already there for you. You just need to tap into it for sure. So thank you for the privilege of being able to come and speak and learn from everybody. And I will continue to learn and keep trying, and I think that's all we can ask of each other for sure.
Well, Dr. McKinney, I thank you. And this is Rick the Liberty reporting from Treaty 10 News in my place in the boreal forest.
Beautiful. And happy holidays, everybody. Take care.